Obed Figueroa, once again, coming back to you. I represent Diversity in Premedical. I am the founder. We title this Lessons Learned. And today we are here with Dr. Siatta Dunbar. And I'd love to share with you her background before we begin. So let me share. So Dr. Dunbar is an osteopathic physician. She is board certified in family medicine with a fellowship training in primary care sports medicine. She is currently the sports medicine physician at MHealth Fairview, Burnsville, Minnesota. She is also completing a core curriculum to be certified as a lifestyle medicine physician by the American Board of Lifestyle Medicine, ABLM. Dr. Dunbar began her academic studies at the University of Virginia, earning a Bachelor's of Science in Architecture. She then pivoted to health sciences, earning a postbac in pre-health at Rutgers University. Dr. Dunbar then went on to earn her doctorate in osteopathic medicine at Touro College of Osteopathic Medicine in Harlem, New York. She is a proud wife and a mom of 2 beautiful children. She's passionate about lifestyle medicine and the power of food. As a certified health coach, she is committed to no longer providing sick care, but rather partnering with her patients to help them become the dominant force in their life and create optimum health and lifelong transformation. So welcome, Dr. Dunbar, welcome.
Thank you so much. It is truly my pleasure, truly.
So I'm so excited to share with you. You've been on a journey for quite some time, and before we do the deep dive, I always like to start with some fun stuff, right? Asking some speed questions just to kind of get to know you better. So the first, without going into fully responding, just the first, response that comes to mind, okay? So PC or Mac?
Oh, Mac, easy.
Android, iPhone?
iPhone.
Favorite season?
Ooh, fall.
Okay. Favorite vacation spot?
Anywhere with blue water and sunshine.
Nice. Favorite restaurant?
As long as it's fresh, like farm to table, fresh veggies, that kind of thing.
Okay. Now, do you have a favorite dessert or food that you just get guilty after you eat it?
So that's interesting, right? Having been on this journey, I sort of have rethought my relationship with food. So I don't like to think of it as a guilt. It's all about choices, right? We make choices and we realize the outcome of those choices. So there are some things that I choose to eat less of, and that would be ice cream.
I like the way you respond to that. It's like reframing how we think. So
Correct.
We're going to go
That's
there.
important. Yeah.
Favorite TV show?
Ooh. Huh. I'll do I'll say Grey's Anatomy.
Okay. Favorite sport?
Soccer.
Favorite music genre?
Hip hop.
Okay. Favorite color?
Blue.
Favorite book?
Ooh. That is a great question. I'm kind of all over the place with books. Right now I'm doing a lot of personal development. So I just read a book called Go for No. I've read some of Simon Sipek's books, so I'm sort of a little all over the book. I don't know if I have a favorite, to be honest with you.
Okay. Favorite car?
Tesla.
Favorite song?
Amazing Grace. Reminds me of my grandmother.
Wow, I think Dr. Peters said the same. And your favorite high school teacher?
Ooh. Huh.
Or subject, if you don't remember the name, which I would doubt.
Yeah, it was probably like, what was it back then? Social studies or history or something along those lines. That kind of thing. I don't remember the teacher's name though.
And what about in college? What was your favorite subject? I guess undergrad.
In undergrad, so that was UVA. Actually really enjoyed an economics class, which is odd because it was completely outside of my major and it was using a completely different side of my brain, and I really, really enjoyed it. Yeah.
Oh, that's interesting.
Yeah.
Okay, well, thank you so much for sharing that. it just, there's those questions helps us to get to know you.
Yeah.
So your journey, like the intention of this program is to communicate to the pre-meds and kind of like share our experiences so that we can help, maybe they can learn something from it, get some insight to the journey that they're about to take that you've already taken. And so like I always try to like, ask specific questions that kind of help to kind of highlight the way you were thinking back in high school or back in undergrad, so that someone may be able to relate to that just by you sharing of your own experience. And
Yeah.
so when you think about you're being in high school, were you thinking about medicine back then?
I wasn't. Mm-mm.
You share what your thinking was back then?
Yeah. Back then I was really more interested in architecture, and that's what I ended up studying. So I really didn't have the health sciences or medicine or any of the STEM, sort of things on my radar at all. And whether that was, a function of just what I had as my exposure.
Mm-hmm.
I didn't have any personal contacts with physicians or anyone that was in those fields. So it just really just didn't seem plausible. But I did have some exposure to an architect, and I enjoyed sort of that tactile fine motor, hand-eye coordination.
Mm-hmm.
So that's really where all of my emphasis was. I did do some volunteering as a BLS provider in one of the firehouses locally when I was in high school, and I enjoyed it. But I honestly really did not have the confidence or the wherewithal to think that, gosh, I could actually have this as a career. Certainly not as a physician. Never really dawned on me till much later in my life. Yeah.
Anyone in your family a physician?
Mm-mm. Nope.
Or nurses?
Mm-mm.
Oh, wow. So you got me
Yeah.
really curious now. So at
Yeah.
what point was that triggered?
Yeah. That was much later. Much later. So it was after my sister passed away from metastatic breast cancer, and I was, gosh, early 20s, I think. Then I went back and really started going to took courses to be a paramedic, right? And then after my mother passed away, that was really what sealed my desire to truly chase medicine. And it really was a bit of encouragement by my brother, because even at that point, I was sort of resigning myself to being a paramedic. Not to say that that's not a good, worthy profession. And it took a lot of talking with him, and him really doing a little bit of boosting of my confidence to say, hey, Siatta, why don't you consider, going to med school? And I sort of poo-pooed, and I said, what, me? There's no way. How could I possibly? And then that's when I went into the postbac, and then applied to med school thereafter. So I had worked, I had done construction management. I'd been out of school for 9 years.
Wow.
And worked before it even was a flicker of a thought that I could actually have the capacity to be a physician. So it was much later. Yeah.
Yeah, so I'm curious on what you were internalizing at that point when you were experiencing that pivot. So I hear that you had the encouragement, and what were the influences, and sorry about your losses, because those are deep. Those are definitely deep. But I'm wondering if someone could, relate to that vulnerability you might have experienced making that pivot, if indeed that is true.
Yeah. It came down to taking a bit of a chance on myself, I guess, and recognizing that I had some support, and there were people that were in my corner. And there were times where if I didn't think it was possible, they thought it was possible enough to kind of nudge me through those difficult times. So I think that, we as individuals may not necessarily have all that we need to get us there. But if we have people that are around us, and it doesn't necessarily mean that it has to be an immediate family member. For me, it happened to be my brother, that can sort of help us see that we have more potential than maybe we give ourselves credit. I think that gets us through, because I didn't have it all the time,
Hmm.
but it was that mentorship or having that support that was helpful for me.
And so you get into the postbac program, and I guess I'm curious to know how were you challenged? Was it in all subjects, or were you feeling like some subjects you had it? Did you have tutoring to get through that postbac?
That was challenging. It really was, because I didn't have any sciences in my traditional undergrad because I did architecture. So it was a complete shift, right? I didn't do even the basic, general chemistry and those sorts of things. So I really had to take all of that stuff.
Mm-hmm.
And it was really challenging for a couple of reasons. One, it was coming back to academics much later was difficult. I had been out, I'd been working and had sort of been successful in that arena. And now I was back in an academic setting where I was uncomfortable. I was much older. I didn't, it was challenging to learn some of that content. Um, it, it took a lot of time and effort, a lot of sacrifice. Um, it was challenging. I don't know that there was any course where I was like, oh, I got this one. It was it was all of it. I worked. I had to work really hard, and make some pretty decent sacrifices with my, just simple things, my social life and what I was doing. It was really just about being singly focused on getting through those 2 years of postbac. But it was all challenging.
Yeah, did you have to go to tutoring or no?
I did. So I certainly spent a lot of time talking to my teachers, trying to figure out, okay, how do I learn some of this material? Definitely reached out for the chemistries, the organic and the gen chem. Those are really challenging. The biology, I had to reach out and ask for some assistance. Um, so being, um, don't let your pride get in the way,
Imagine. Yeah.
right? You got to be humble enough to ask for help. I mean, even now, fast forward, I'm through, I'm working, and um, there will always be times where you may not have the skill set, the knowledge, the whatever it takes to provide whatever care to that person that's in front of you.
Mhm.
And being humble enough to recognize that this is something I need to ask help for, or clarity, or consult. We call it a consult.
Mhm. Mhm.
Being okay with that. And that's exactly what you do during your educational years, through your formative years, is asking for help. There's no shame in that. And in fact, I think it makes us better prepared as we're practicing clinicians to
Mhm.
rely on our colleagues that have additional expertise outside of what we've chosen to focus on.
Right. So I would imagine, during the postbac, you are also preparing for the standardized exam, the MCAT, right? So it's a beast.
Oh,
Yeah, it's
it gives
changed.
me heebie-jeebies just thinking about it.
Yeah, it's
Oh.
changed a little since you've taken it. However, still challenging. So I'm just curious, how did you feel about approaching it, and did you have a strategy for it?
That was another one where I took one of the prep courses. And um, I think I barely squeaked by with the score. That was, oh,
I'm sorry to stir up that feeling, but you got
oh,
past it.
I got past it. Um, yeah, yeah. Because the frustrating thing is those things don't test competence, right? I mean, they don't test knowledge. They don't test, whether someone deserves to be a physician or deserves to get into med school. They don't test any of that. It tests, can you take a test?
Mhm.
But I don't think you want to go down that tangent on my personal feelings about standardized tests. Um,
But you did the
but
test prep.
what's that?
You did the test prep, you said.
Oh, for sure.
Yeah.
Absolutely. Lots of hours doing that thing and figuring out how to take that test, because that's truly what it is figuring out how to take that test.
Did you take it more than
Um,
once?
it's sad. I don't even remember. I don't think so.
Yeah, you
I
blocked
don't
it
think
out.
I blocked it out. I don't think I did, but I certainly did not score at the top by
Mhm.
any stretch, right?
You're a physician.
Right. And I think that's really what anybody that's considering any kind of health field is you don't have to be the top 2% or the top 1%. I think you have to have the commitment. It is always helpful to have some support. Don't be afraid to ask for help, reach out. But you do not have to be the cream of the crop in order to get into med school and to be an excellent physician and to be able to reach, whatever your community is and whoever you choose to take care of and partner with in their health. There's still that opportunity.
So now you had the audacity to go and apply to a doctorate level program, the first in your family, unfamiliar space, and you did it. So I am curious on what you were thinking at that point. Okay, you've done the postbac, you achieved that, you took the MCAT, you achieved that, and now this beast of going into a doctorate program. What were you thinking as you started to apply?
Terrified.
Yeah.
Terrified. What have I gotten myself into?
Okay.
Terrified. Yeah, right. And everywhere along the way, there was always an element of a fear of failure of, I'm not going to get there. I'm not going to be good enough. I'm not going to be able to compete. But certainly once you get to that point, there was no stepping off the gas, and there was no like, oh, now I've made it. There's always that doubt. There's always that, am I really going to be able to cut it? And am I going to come out of this the type of physician that I want to be and make the kind of impact that I want to make?
So these postbac programs and getting yourself prepared for the doctorate level study, do you feel like they prepared you well, not just for knowledge base, but be prepared to go into a doctorate program, or did you have to do some additional research?
As far as from an academic setting, because I think there's a couple of ways. I mean, are you emotionally ready?
Yeah.
Are you, mentally in the right place? And then there's the true academics, the true knowledge. I mean, I think from an academic standpoint, absolutely, I think Postbac did a great job as best it could. And this is coming from someone who didn't have any of the sciences, right? So I really had a clean slate when I started my Postbac. So from an academic setting, I think it did a fantastic job to give me that foundational knowledge to be able to build on when I got to med school. I think when you talk about, well, did it prepare me emotionally, or what the degree of sacrifice would be in med school? I don't know that anything prepares us for that, to be honest with you. I mean, that's a whole nother level of commitment that I don't think there's anything, even going through architecture, which was a pretty grueling undergraduate regiment, still pales in comparison to the level of focus and dedication that you have to have when you in order to get through med school.
Yeah, I was speaking to another, and she had mentioned that the business aspect of medicine she felt was not taught in med school. And so when she was facing that, she had to learn that quickly. Yeah, so I'm sure there are lots of things. And God, I almost am hesitant to actually encourage it, because the volume of information you already are receiving just to get through it, dare I not add to it. Dare not add to it. I don't know.
Yeah, it would be challenging. I mean, I remember vividly, it was my anatomy professor that said, I think it was anatomy, who said being in med school is like learning to drink out of a fire hose. And I think that's the best analogy I've heard, and it truly is, right? How do you take in that volume of information and then be able to, make some good clinical decisions off of it, right? And bring it back out when it's necessary. And then there's the whole, interpersonal part of being a physician that I think you also can't teach. I mean, you can a little bit, but that whole part also goes into being a doc. It's not just putting all that information in our head. Is how do we apply it to the person that's sitting in front of us, which it's not a textbook, right? It's a person with thoughts and feelings and a family that love them. So
I'm curious, now so let's fast forward, you're in med school now, and how did you manage that? Were you doing it collectively with people, like-minded people, or were you just by yourself? Like, how did you get through managing?
That was a struggle for me. I felt like I kind of bounced between. There were definitely a few people that I connected with pretty early on, and we tended to study together, and that was helpful. Also because I honestly felt like I was so far behind, whether that was just my own mindset, which is probably some of it, or whether it was reality, right? But sometimes our beliefs make our reality. So if we believe that we are behind, then that almost comes to pass, right? So I felt behind. It was probably more a belief than the truth.
Definitely.
So I tried to rally myself around some people that I felt could help me be successful. But I also spent a fair amount of time studying individually, just because I learned that the way I learned required a lot of repetition and writing. So I needed my own time to do that. So I danced between both, right? I would have study time with people, but then I would also do things on my own in order to really try to get it in and make sure that it became second nature for me. And that I just learned, right? That's the other thing. I don't know that you can, everybody's different. Everyone's got their own learnings, and you just kind of learn that as you go.
Yeah, I get that. There's definitely there's no one boilerplate for sure. Because we all learn differently. And as you were speaking about how you study, I was thinking of my own self and how I need to write as well, because as I'm writing it, psychologically in my mind, it's just there's the connection that's made versus just looking at a screen.
Yep.
Like, I don't know what that is. I can't even articulate it, but just that's what works for me. Like I get it.
Yeah.
I get it.
And I learned that I wasn't an auditory learner, right? I just being in lecture and listening to it, it doesn't connect and it doesn't resonate. I have to go through that process. That's how I learned. I learned that that's how I learn. And I don't know that I paid attention to that any other time, even getting through architecture school. I don't know that I really, but again, the volume of information, you learn pretty quick how to negotiate that space.
Yeah, man, did I feel for you guys? I really did. So okay, so we're moving forward. You become a physician, so very proud of you.
Thank you.
And now I'm wondering, going into that space, right? Like that's next level again. Was it what you thought it would be? Were you disillusioned at all?
Yeah. When you bring up the business side, I think that's that you learn really early, or at least I did. I learned, or I start to see that being a practicing physician, it's not just about taking care of people. There's all these other things. Again, in the traditional healthcare model, there are other demands and pressures that are put on all healthcare providers, not just physicians, but physicians' assistants and nurses and all of these other things that go into running the beast that is our healthcare system, that detracts from true patient care, in my personal opinion.
Gotcha.
So that piece was a rude awakening. It really was. And I have continued to sort of struggle with that. And that's a lot of the reason why I've really shifted towards lifestyle medicine and shifted towards coaching, is because it allows me to get back to why I entered medicine in the first place, is to truly be impactful for people's long-term health and their quality of life. And in a large system as an employed physician, the minutia of the business of healthcare really muddies the waters. And that's been challenging.
I've heard that. I have heard that. Could you give us what does a day in life look like for you?
Yeah. They're quick encounters. So I usually start my day, and our clinics have gone through a lot of flux because of the COVID outbreak. So, we've gone from March, where we shut clinics down, to opening slowly, to now where I'm just about back to my normal volume. I do all of my clinical face-to-face contact within 4 days, as opposed to a 5-day work week. So there's flexibility, which I will say, which has been nice, right? So recognize that whatever field you go in, generally there's still flexibility within that field to accommodate, if you've got some family demands and that kind of thing. So for my family, it works for me to do my clinical hours in 4 days, but then that means 2 days are really long. So I go from 7 to 7. And then my Monday is, 7 to like noon. And then my Friday is from 8 to 4 or something like that. Given that I'm a specialist, or considered a specialist, because I do sports and orthopedics, they're really quick visits. They're 20-minute visits. And I see really all musculoskeletal care, acute and chronic. I see some that are really super athletic. I see others that are struggling with a lot of comorbidities that are preventing their ability, again, to have this true good quality of life. aside from whatever their orthopedic issues are. I do a fair amount of injections. I use an ultrasound machine for looking inside and diagnosing muscle tears or trigger finger and using them for guidance with injections. I do PRP, or platelet-rich plasma, which is a form of a biologic, comes from your platelets. So I do that for orthopedics. So I have a good amount of variety, which I really enjoy. And I love, again, when I think back, I'm like, gosh, how did I get from architecture to sports medicine? But again, that fine motor, that hand-eye coordination, the procedures that I do in sports medicine, I think that's where that love comes from, and some of the things that I did back in, although it's not drafting, but it's still that hand-eye coordination that is paid forward for me.
And so someone considering going into sports medicine, could you help me understand, and these pre-meds understand as well, what does sports medicine mean within the space of medicine? And then what's the options you see for them?
Yeah. So there's a couple different ways. So you can be like myself, a primary care sports medicine physician, which means you went to some sort of a medicine residency, and that can either be family medicine, internal medicine. You can get through emergency medicine, pediatrics. And then from there, you tack on a fellowship, which is usually a year of primary care sports medicine. And that can be either, most of them are affiliated with some sort of athletic institution, whether it's a college or you're covering some adult leagues, wherever you do your fellowship. And that fellowship year is primarily musculoskeletal care. And generally you're dealing with a more athletic population, generally speaking. And then that's where I did all my ultrasound training. You can also hear the term sports medicine, but more in a surgical setting, in which case you've gone through and did a surgery residency or an orthopedic surgery residency. And then you again tacked on a sports medicine fellowship after that, but that's in the surgical context. So for me, I'm non-surgical, or you could do it the surgical route. So I don't know if that helps.
That absolutely does. It also educates me at a level. Now, from your experience, and again, I'm looking to see if there's anyone from our members that can relate to you in all that you're saying, and I'm sure they can. As a woman of color, have you had any eye-opening experiences or anything that could be helpful for those? Do you feel the only at all, as I have throughout my career, and to which I've expressed how I deal? How do I get supports? Can you share if there's anything in any aspect that you want?
Yeah. And I'll kind of go back to med school. I think Toro had now granted, I didn't have a comparison, right? So it's not like I said, oh, I went to this med school and now I'm comparing it to Toro. So obviously, going to Toro, that was my first medical school that I've ever been to. But in thinking about what are the general demographics of physicians, I think we had a pretty good diverse class. We certainly weren't abundant, but there were a handful of us, and we tended to kind of gravitate towards each other. Once I got out of med school and went to fellowship, those numbers got smaller and smaller, to be honest with you. I think in my fellowship, I was fortunate enough that I shared time between Rutgers and Princeton University. And the two physicians that were primary educators for our fellows were female. So I was exceptionally fortunate for that relationship and that mentorship. And I still talk to them to this day. And they're still very much a part of my life personally and professionally. And that was a really rich experience for me, to be able to see women in the field, very accomplished, doing what they love to do. But women of color, very few, and they were not, right? So very few. And as I've now stepped into being a physician at MHealth Fairview, certainly there are no other sports medicine female of color that I'm aware of within MHealth Fairview. So it
remains a challenge.
Without going,
It remains a challenge. Yeah.
It does. And, when I think about, okay, how do I give somebody some guidance on how to navigate that? I don't know that I've really figured that out, to be honest with you.
Okay.
I got to be honest with you. I
Mm-hmm.
don't know that I have, do this and do that, because that's really worked out well for me. I think it is easier to find other females.
Mm-hmm. Mm-hmm.
And I think, that can be helpful to have that connection and that relationship.
Yeah. Some
Women
commonality.
of, yeah, women of color, it gets a little, the numbers get smaller. And certainly within orthopedics and sports, even smaller.
Yeah. So this is part of my intention with all so much that I do, that we kind of get the information to the young people, and for the young people to see us and be able to, hear us.
Mhm.
But I get it. Like, it's not to imply that we have all the answers. We have this solid formula, but just to share with them that, yes, we have some commonalities with you. We can talk with you. Because that lonely feeling is just not, and so we learn to cope with it, right? Like
Yeah.
what hits me so much about you is that you have and I know your journey's not over, and it's never been over, but I have found, and now even more, you have such a strong sense of self. Like now, the things that you've been doing over the years, it's even stronger. That has to help in grounding you, and you're doing all that you do. So even coping with the only, right?
Right.
Making it a
Yeah.
positive, not a negative. I mean, just reframing how you think. So for those in Minnesota, with the little black girls in the classroom and the only one thinking medicine, oh my God, like we have to like get it out there, like, check out this
Yeah.
video, like listen, see
Yes.
and listen,
Yes.
so we can influence them. Um,
Yeah.
and that's my intention of sharing these stories, because you're not alone.
Yeah.
You're not alone.
I would 100% agree. And I think, COVID has been a challenge, but I also think there's been some blessings that have come out of COVID. I think it has truly, um, for those that are ready and willing to have these conversations,
Mhm.
it has opened that door and given people the opportunity to really make diversity and inclusion a priority.
Mhm.
Some people are being dragged along kicking and screaming. Some are, still holding on back here and saying, I refuse to let go. And then there are others that are stepping into it willingly. And I've even seen in Minnesota, there's been a lot of conversation around diversity and inclusion,
Nice.
even, reaching, way down into the high school like you do. In fact, now that I think about it, I'm going to try to connect you with somebody here in Minnesota, because it truly does, if we can provide some mentorship at a younger age,
Mhm.
then it makes the steps going forward a little less challenging, even if it's just to have access to somebody that has done this, and who can speak to tips, tricks, or really just that looks like you. Because when you don't see people that look like you doing what you want, it's hard. You get to think, well, maybe it's not even possible. So COVID, I think, has really pushed that issue, right? We need to make this a priority. And there's some work being done in that regard, which is hopeful. I'm hopeful for that. Yeah.
Yeah. So without it, I don't want to have assumption. So all that I feel from you, um, about you being centered and just grounded and confident and in these spaces, how and you're still figuring it out, right? You don't have the master
Oh, yeah.
plan. But I guess for people to get tips from you, what have you put together so far that help you just like stay focused and feeling good about who you are, and how is that happening? How did that happen?
Yeah. Um, I think the one thing that I would say is, um, try not to be afraid. Um, and what I mean by that is, as I've just been putting one foot in front of the other, and it's not until I have these conversations that I sit back and think, and I'm like, what? How did I end up here? Right? It's like, what in the world? Um, so I think what I would say is, just because you start in one direction
Mm-hmm.
doesn't mean you have to continue that way.
Mm-hmm.
Um, and there's a tremendous amount of variability and options within medicine, and to not be afraid to pivot because it speaks to who you are. Don't, don't feel like you have to just keep going in one direction if it doesn't honor what you truly want your legacy to be. And that just requires some self-reflection, and conversation with people that may know you or that you've had interactions with. And if you are not in the situation, again, that honors that legacy, then you start to pick up the phone and you start to call people and try to surround yourself with those that are doing the thing you want to do. And what I've realized is it doesn't necessarily mean that the phone call is to that person that's in that field, right? But making connections and letting your intentions be known to people, things will come to you, but you've got to state those intentions. So don't be afraid to put those out there and to ask for help or ask for opportunities or ask for mentorship. Because that person may not be able to help you, but then it's top of mind. And if they run across somebody, oh, that's right, so-and-so just called me, I need to connect those two people. So just continue to have conversations and make your intentions and your desires known, is what I would say.
No, well said. It's really nice to hear you. And then, so you've been recently, on fire with, helping people lose weight. And I'd love for them to understand, why being in that space speaks to you so much.
Yeah. So part of what brought me to medicine, like you mentioned, were two pretty big losses in my life. My sister passed away really, really young. She was 31 and had metastatic breast cancer. And then my mom, in this day and age, for me, and really I think by any medical standards, passed away also very young at 55 of a heart attack. And heart disease is preventable in most cases. Diabetes, type 2 diabetes, is preventable. High cholesterol, all these things that take our lives way too young are preventable if we would just intervene earlier. And lifestyle medicine, the pillars of lifestyle medicine is really about, eating well, moving more, love more, stress less. There were 4 pillars. I just listened to one of our lifestyle medicine conferences, and one of the docs who's done, Dr. Ornish, who's done a tremendous amount of research in lifestyle medicine and heart disease. That's how he boiled down lifestyle medicine. And I think if we get back to those roots, that really speaks to why I started this in the first place, is to truly affect people's quality of life. I tell my patients all the time, you may not be able to define your quantity, whatever God you believe in, but your quality you can change. And it's about having and making intentional choices about how we walk through life, what we eat, how we move, how we interact, and the relationships that we develop that define our quality of life. So for me, this is why I did this, right? Like this is why I stepped into medicine, is to be able to sit across a table from a patient and say, what are your goals? I can give you a long list of your diagnoses, but what do you want out of your life? What fills your cup? What brings you quality of life? And how do we get you there? How do we change some of our choices and our habits so that you can see that 10-year vision that you want, as opposed to where you're headed right now? Because most of it is preventable and reversible, which the more I talk to people, their patients, they just assume this diagnosis we've given them, oh, you're diabetic, carries them for the rest, and they take it on as an identity. Oh, I'm a diabetic. And when I tell them, type 2 in most cases, the earlier we intervene is reversible. And I tell them it's reversible. And it's like, no one's ever told them that. They just assume their whole life they would be a diabetic.
Yeah.
And when you make that shift and you say, you got to work on your choices. So that's the Holy Grail.
And
that's the Holy Grail.
Yeah, I wonder if I can ask this. If it requires more discussion, you let me know. I wonder if you're finding it more challenging with the variation of cultures and
and how we make connections to foods and experiences, and does that impact one really wanting to be engaged in changing those things?
Yeah.
Have you had dialogue with them about that? Like, it doesn't mean you're gonna, not be part of your culture by not experiencing these things or changing.
That is a profound thing. Yes.
Mm.
And in fact, again, the lifestyle medicine conference that we've just had over the last couple of days, there was a whole panel discussion on that, right?
Mm-hmm.
About how, especially when it comes to people of color, and how do we introduce lifestyle medicine? Because, sometimes it is a cultural thing, or it's, oh, we don't eat that food, and what are the roots of Southern cooking, and
Mm-hmm.
teaching, that the Southern food that we may be hanging on to actually has some roots that you may not want to hang on to, right? So it is challenging, right? I mean, I was born in Liberia.
Mm-hmm.
We left Liberia when I was 8, so most of my adult life has been here. But my mom's generation and my aunts and uncles still eat all the food from back home, and it is very much a part of who they are, right? It's like, it is ingrained in them.
Yeah.
But it is wildly unhealthy.
Mm.
And I'm having that conversation around, how do we still maintain our culture, maintain our identity, maintain our connectivity to home,
Mm-hmm.
but feed ourselves in a more nutritionally based way?
Yeah.
And I'm navigating that. I'm trying it.
Yeah,
But it's true, right? Because until you can
worth it.
until you can meet people, again, it's about meeting people where they are, and until you can do that, you may not be able to help them make that change.
Yeah, I've read the articles on this. I've done research on it as well. Like, that cultural connection is really key. So can you imagine someone to share? So imagining a physician outside of your culture telling you can't do this, you should not do that. Like, you're going to be so turned off of wanting. You're not going to be receptive to anything more that they're saying.
Yep.
If they can't relate to what they're telling you don't do, right?
Correct. Very true. Very true.
It's a big thing. And the goal
which is
so much bigger.
Yeah. And I think, which is why I think some of the work that you do, and if we can sort of increase, we take guidance better from people that I think, one, we have a connection to, we trust, that we feel identifies with us, or we identify with them. And I think as we continue to make inclusion and diversity a priority within healthcare and within medicine, by doing so, we give our collective communities and patients an opportunity to sit across the table from someone who is from their community, who can speak to, I know exactly what you're going through because I am you. And I can help you navigate this, right? So that's why what you do is infinitely important, because we need to flood the field.
Yeah, it'll happen. It'll absolutely
It
happen.
will.
All right. Listen, thank you so much. Is there anything more you'd like to share with the students?
Yeah. I want to share or say a thank you to you, because I remember when I was applying to med school, you were one of my first interactions at Toro, and you have been a constant. And what you do is so much appreciated and so needed. And keep doing what you're doing, because you're impacting lives well beyond the time when we leave you, right? Your mentorship and what you stand for and what you do and your availability and your conversation and your connection with people sticks. It sticks, and it pays forward for years after we left those four walls in Harlem. So thank you.
Oh, thank
Seriously.
you. Very proud of you. Very proud of you.
Thank you.
All right, guys. So this ends Lessons Learned. This is this episode. I look forward to reconnecting with you guys again. Thank you, Dr. Siatta Dunbar. Thank you so much. And I appreciate your family allowing us to have time with you.